I'm Dr. Isaac Orech, Director of Victoria School of Nursing and Midwifery. And this morning I'm happy to introduce and welcome you again to Victoria School of Nursing and Midwifery. This morning we are glad to announce that we have received our consignment, which was procured by Victoria School of Nursing and Midwifery at school, which are anatomical models are used for training students, student nurses and midwives with the skills, hands-on skills that can make them responsive enough to the health needs of the patient when they go to the wards and they go to the hospitals. Okay. And so I have them here displayed. Straight away we have Madame Zo, the model of a pregnant woman. And this one is even electrical. When you put on power, it begins to produce the heart sound of a baby and the breast sounds of a mother. And this one makes training a student very, very practical. Then I have the model of a whole human being, the mannequin. This one is meant to train a student everything about a human being. You turn the back, you turn the front, the legs, the hands, the eyes, and everything. And then we have the model of the buttocks with the wounds. This one is to teach nursing students how to care for wounds of the patient. Wound dressing, deep wounds, superficial wounds, and the rest. And here I have the babies. And this one is to show, is to demonstrate how babies can be delivered from the pregnant woman. And then this is the model of a female breast, which is meant to teach a student how to examine breast, diagnose patients with a breast cancer, breast swelling, breast abscess, and many other problems in the breast. And so this helps the midwives very significantly. And of course, many others which are in the boxes, not yet open. We can't explain one by one because it's a big consignment. So I want to thank management at Victoria School of Nursing and Midwifery, as well as students, and want to thank the parents for supporting Victoria School of Nursing and Midwifery. And I can assure you, our skills simulation laboratory has added more value today, almost by 80% again. So additional equipment have come, meaning that this one we can train more number of students without any problem. And so we want to welcome more students. Parents send students, they're ready. And we are ready to learn. We're ready to train students into 5-star nurses and 5-star midwives.
Okay.
Welcome to Victoria.
Can start.
Well, thank you so much. My name is Daniel Udon, a proud student of Victoria School of Nursing and Midwifery, a student leader under UNASNAM. I am so glad to inform all of us today that Victoria School of Nursing and Midwifery has just received another practical equipment, the anatomical things that helps the students to always have more skills on the issues of practical. We are so happy in Victoria because we are being trained not only as nurses but as 5-star nurses, and we are happy for what the management of the school is doing. As you can see, we have a lot of things in our skills lab. Others and more are yet to be added, and they're coming on the way. Thank you so much. I want to welcome all of you to Victoria. Make sure
Why is Victoria the best nursing training institution in Lamu?
Well, Victoria is not only the best training school in Lamu, but Victoria has taken another step into training the young people of impact onto this land. That Victoria has brought a lot of skills, hands-on skills. When you check in the referral or the practicum areas, you find that Victoria students are leading because of what the management of the school is doing. So generally, Victoria is conquering the land, and Victoria is the best school.
Thank you.
Equipments provided by the director will equip our students with the knowledge, with the skills, because they will learn how to examine the mother, how to carry out the other procedures like bed bath and everything on these models. It will also help the students how to care for the pressure source on the patient when they're learning exactly on the model. We will carry out the dressing. Now, when they come to this, they will give them equipment of categorizing a patient. Yeah. It is both male and female. You only replace. When they want the female categorization, they use this one. If they want for the male categorization, they are going to remove that part and replace the one for the male organ, which is supposed to be there. Then for the babies, it will help them to learn the skills of conducting delivery, caring for the baby, bathing the baby, carrying out examination of the newborn baby. So all this will equip our students with knowledge, skill, and it will make them to change attitudes. Managing the patient, they will start from here. When they have built their skill, then they take to the living patients in the hospital.
So
that's why I want them to start from here.
with this, do you think Victoria will produce good 5-star nurses and midwifery?
Exactly. It will be a 5-star nursing with enough skills, knowledge.
Okay, your last remark to the to the parents who are outside there.
My remark to the parents outside, they should hurry to bring their students or their children here. They will be really marketable to the world because of the skill and the 5-star they are going to have from here.
Okay.
That's my advice to the parents in the society there. Let them bring their children. We are ready to get them, to equip them, care for them, give them all the best welfare, and they go out the world.
Thank you.
And they will also sell the school.
Okay. Thank you, sister. In West, okay.
I'm called Midwifery, the Dean of Students, Victoria School of Nursing and Midwifery. With these models in place, we expect better clinical skills from our students. Because as you know, before these students are taken to the ward to touch real patients or human beings, they start practicing from here. And it is from here that they either master the skills that they should learn so that when they touch the real patients, the patients are in safe hands. So we expect better clinical skills and better performance in the newer public health space.
Okay.
Okay, my name is Mwangs Esther. I'm a student of Victoria School of Nursing and Midwifery. We have here some equipments which are brought by our school administration. I'm so happy of them bringing those equipments because they're going to help us improving on our skills. We are going to use them in practicals. I'm very happy to see them there. I'm even excited. They are going to help us to improve on our studies. We are going to use them in practicals to learn. So I'm too happy.
So
We were having a lot of challenges. We were having a lot of challenges. We had no enough equipments to use, and students we are very many. So at least we are happy we have enough. At least we shall use those ones to improve on our skills.
okay, what's your message to the parents and students who are outside who have not yet joined
My
Victoria?
message is I encourage the students outside to come and join Victoria School of Nursing and Midwifery because it is a school. It is a good school. It teaches people practice. What we learn a lot from this school, and most of the people that have benefited in it.
Okay. Thank you.